Hallo en welkom by die heel eerste episode van Ons Groei Saam. My naam is Anay en ek is nou al in my 3de trimester van swangerskap. Hierso op Ons Groei Saam volg ons my swangerskap en ons kyk na die pad wat mens stap na ouer wees. En ons gaan kyk na wat dit beteken om swanger te wees. Meeste ouers wat tradisioneel swanger word, is nie bewus van alternatiewe swangerskappe nie. Daar's 'n hele groep ouers wat sukkel om swanger te word, wat dan juis kyk na alternatiewe swangerskappe. Ons gaan vandag gesels met Marion Stander, wat gesukkel het met onvrugbaarheid en hoe sy en haar man uiteindelik kleine lyfies in hul gesin in kon bring. Ook in enige swangerskap is dit baie belangrik vir mamas om gesond te wees, want 'n gesonde mamma is 'n gesonde baba. So vir baie mamas is dit belangrik om gesond te wees en aktief te bly, om 'n gesonde leefstyl te werf of te behou tydens hul swangerskap. Maar mamas moet onthou dat die lyf baie aanpassings maak vir swangerskap. Jou heupe verbreed en voel losser. Jou bene word sagter, jou spiere en jou organe skuif om plek te maak vir baba. En mamas moet oppas om nie gevaarlike oefeninge aan te pak tydens hul swangerskap nie. So dit is beter om professionele advies te kry vanaf kenners. So vandag gaan ons gesels met Fit for Two. Fit for Two is 'n preggy mommy en mommy and baby fitnessprogram en organisasie. Ons gaan gesels met Jill en Kayla, 2 biokinetikuste vanaf Fit for Two. En ons gaan groot pryse weggee in hierdie seisoen. 'n Gelukkige kyker gaan 'n prys wen ter waarde van meer as R7.000. Maar heel eerste gaan ons gesels met Marion Stander, wat gesukkel het met onvrugbaarheid en hoe sy en haar man uiteindelik kleine lyfies kon verwelkom in hul gesin in. Volgende op Ons Groei Saam. Saam met my in die ateljee is Marion Stander. Welcome.
Thank you.
I want to talk to you about infertility. And I think there are many women out there who experience it. And the women who conceive traditionally, they are not aware about the challenges that families face with infertility. So tell me your story.
So unfortunately, a large number of women face infertility issues. In statistics in South Africa are almost 3 in 5 women. So it's unfortunately a very high number due to lifestyle. Women having babies later. I was 37 when I conceived, so that may have been a factor. And then also, I knew that we were going to struggle. I was diagnosed with endometriosis when I was 19, so I've had multiple laparoscopies and ablations to treat that. And so when my husband and I met, we had the discussion, and when I knew he was the right person for me, we decided to actually harvest and freeze embryos at that point. Okay. So when we were 34, before I got married, we harvested and froze those embryos.
So you harvest the eggs and then you fertilize them?
Harvest the eggs. So you go through about a 2-week process of hormones, and then after day 5 you go for checkups every day to check how many follicles are sitting on your ovaries. Follicles give an indication of how many eggs they are, and the size of the follicles give an indication of how ready they are to harvest. So you go for your constant kind of checks, and then when they think it's time, they give you a trigger shot, and that causes the eggs to kind of pop out, I guess. And then you go for harvesting, which is quite a simple procedure. They basically stick a needle in. And
is it sore?
You are under anesthetic, so it was sore afterwards. It just felt like pressure. So they go in and then they aspirate. They basically gently pull the eggs out, and then they keep those in sterile conditions, and then they introduce sperm. So they can do that one of 2 ways. The first time we did it, they just kind of introduced the sperm and natural implantation. And then the second time we did it, they did it via ICSI, which is where they actually inject the sperm into the egg, which just increases the chance of fertilization.
And this is called, is this IVF?
So IVF is the whole process, and then the injecting the sperm into the egg is called ICSI. So.
But you did this process twice?
I did, yeah. So we did it before we got married, and then when we started to try to conceive once we were married, we went through a whole other course of treatment. So we did Clomid, which gives you higher egg production. We did all sorts of kind of natural fertility treatments.
So you tried to conceive naturally first before
we
going for the backup of the frozen eggs?
100%. So the doctors advised that you try for about 2 years, depending on your age. Because I was over 35, and a pregnancy over 35 is considered a geriatric pregnancy.
Oh, wow.
Yeah, it's amazing. So because I was over 35, we waited only a year, and then they suggested that we start with the IVF process. So we went through all the hormones, etc., etc., and then they harvested. And the big thing for you is you harvest and you're asleep, you wake up and first thing you want to know is how many eggs did they get? How many eggs did they get? So the first time they got 11 eggs and the second time they got 9 eggs. And then you have to wait the 4-day countdown, how many have survived, how many have fertilized, etc., etc. So you go through the steps of waiting to see how many eggs fertilize. So in our case, in the second round, we had 9. 6 of them survived and 5 of them actually fertilized. So they then take those 5 eggs and they store them, and then you go for implantation. So usually, if you're not high risk, they'll implant 2. If you're high risk, they'll only implant 1. We were very, very lucky. 2 got implanted, and 2 weeks later we found out we were pregnant. I didn't know yet it was twins. I only found out at about 8 weeks that it was twins. So
and then you said you found your husband?
I had a feeling it was twins, but I only found out at 8 weeks it was twins.
And then you said you found your husband?
So then when at 4 weeks, when I found out I was pregnant, I was in Chicago, found my husband in a complete state. So the first call after my husband was to my mom, and by then I'd calmed down a bit, and Mom, I'm pregnant. And my mom burst into tears, and it was a very emotional time for us. And then we came back and we had the most amazing fertility specialist at MedFem, Dr. Jo Pateau. She was incredible. The whole way through the journey, she just reassured us. And then when we were with Jo, it was incredible. We always saw her. She was so reassuring, and she obviously can't guarantee that you will fall pregnant, but I know that our chances were better because we were with someone who cared as much as she did. And then, we had the scans, and you have to go for your official test. You obviously have done the pee on the stick thing, but you have to go for the official test. And then you walk out into this waiting room, and there's maybe about 30 women who are all sitting at some point in the process waiting for the doctor's appointments. And you have to almost swallow your happiness, because you've come right, and you know of those 30
women, you don't know
women,
what their case is.
20 of them may not be coming right. And it's a heavy, heavy process. And
sure. Is that like the odds? What are the odds?
So it's 3 in 5. 3 in 5 women struggle with infertility. It's huge.
Is that with or without treatments?
So of the 3 in 5 that struggle, you then go through treatment, and the success rates depends, again, factors like age, but the success rate's as low as 60%.
This is why you don't just ask a couple, when are you getting babies?
Exactly.
Because you have no idea they might be trying, and they might have been trying for years, and that might just be something that is really so it's
heartbreaking.
Yeah.
Especially when you know people they would be amazing parents, and they're not. I think my family is amazing. I have a very, very supportive family. My husband was incredible. We spoke through it, and whatever was going to come, and we just resolved that whatever God chose to give us would be our baby. So that's how we coped. You still obviously worry about it, and as much as you go, what happens will happen, you still worry, but that's how we coped.
Thank you so much. Thank you for sharing your story, and I'm really glad that you reached success and that you have your family like God intended and like you wanted. And I do hope that anyone watching who might be struggling with this, that I do really hope that you get your little baby that you so dearly want.
Yeah, that you deserve. Thank you.
As jy enige pyn of ongemak beleef voor, tydens of na jou swangerskap, kan jy die raad neem van 'n women's health physiotherapist. Kirsty Nel vanaf And Her Physiotherapy gaan nou vir ons 'n paar wenke gee oor wat jy kan doen om gemakliker te wees. Volgende.
Hi everyone, it's Kirsty from And Her Physiotherapy, and today I'd like to talk to you about how to Kegel correctly. A Kegel is a pelvic floor exercise that's very important for your pelvic floor health. It's used to strengthen the muscles so that you can maintain bladder continence, bowel continence. It helps to reduce pelvic pain and is very important for general strengthening of the pelvic floor. Now, a common misconception when you Kegel and how women are taught to Kegel is to sit on the toilet and hold back urine. This is incorrect, as it creates an anterior association with the pelvic floor around the front of the vagina, which ultimately causes more tension in the muscles rather than activating the power correctly. So today I'd like to give you a couple of tips on how to Kegel correctly. If we have a quick look at the anatomy, we can see that the pelvic floor is very posterior in its association at the back. around the anus. So the correct way to actually do a Kegel is to initiate from your anus, almost like as if you had a wind coming and you wanted to hold back on that wind, you would tighten your bum and lift up. Now, to visualize this and make a mental connection, I use several cues in my practice that help patients to connect a little bit more with that feeling. So the first one is to imagine that you have a blueberry in the muscle of the pelvic floor, and when you do your Kegel, you want to initiate it from the anus and imagine that you are lifting that blueberry up gently and then releasing it slowly down. You don't want to crush the blueberry, you don't want to be too weak that the blueberry feels like it might disappear. It's a gentle lift and a gentle release, initiating from the anus through to the vagina. You can also visualize your anus moving up towards your vagina, like you would be closing in these two areas together. Almost like if I had a zip and I told you to zip up to the front and then release out to the back. A nice visualization to imagine relaxation is to imagine a wave coming up onto a beach, and if you were to relax the muscle, that wave would be pulling back into the ocean as a gentle release. It doesn't drop, it doesn't stagnate, it's a gentle lift up and down. Last one, just like a jellyfish in the ocean, if you imagine how jellyfish swim around, pulling up and then splaying out as they activate and move through the water. And that's where you want to have your Kegel. If you're worried about your pelvic floor, if you're battling with any pelvic floor dysfunction and pain and would like to have more information, please contact me at And Her Physiotherapy or give me a ring on 082 411 4026.
Volgende gaan ons gesels met Jill en Kayla, twee biokinetikuste vanaf die Preggy Mom en Mommy en Baby Fitness program Fit for Two hier in studio. Ek gesels nou met biokinetikuste vanaf Fit for Two, Jill en Kayla in studio. Welcome, ladies.
Thank you. Hi.
So, ladies, let's talk a little bit about Fit for Two. How did it start, right, and why? Why start a organization for mummies and preggy mummies and so on?
Sure. So Fit for Two, we started because Jill and myself are both mums, and we have such a passion for supporting mums throughout their pregnancy and beyond their pregnancy. We both biokineticists, and it's really important for us to get the message across on how important it is to exercise during pregnancy. And a lot of mums don't quite know what to do. So we started Fit for Two to guide mums and to really help them throughout their pregnancy. It has so many benefits, which I'm sure we'll go through just now. But to exercise during your pregnancy can help with just an easier pregnancy, a healthier pregnancy. So we wanted to promote that healthy pregnancy in women, and also give them that after postnatal support with our mums, because a lot of ladies don't quite know what to do after they've had baby and they want to get back into exercising, but they don't know when or how. So our whole goal in starting Fit for Two is really to promote health and wellness during pregnancy and post-pregnancy as well.
Now, why is it important for a mom to be guided with fitness during or after pregnancy? Why can't she just do her normal fitness routine like she did before?
So I think a lot of mums, they can go on either end of the spectrum. So a lot of mums will stop exercising completely when they're pregnant just because they're nervous, they're too nervous to do anything.
That's not necessarily a good thing.
No, so they'll be too scared to do anything. They don't want to hurt the baby, they don't want to, do anything that would put the baby at risk. So that's what quite a few mums do. And then the other end of the spectrum is some moms will just do too much. So they'll carry on doing their CrossFit, they'll want to run races, and sometimes they can be overdoing it a bit. So we feel our role is to guide them on how to do safe, effective and fun exercise, which can be done throughout their pregnancy. So they can start, we generally recommend starting once you've been for your 12-week scan, just checking that everything's okay, and then they can keep going right up until the day they give birth, which is really nice. And with pregnancy comes a lot of aches and pains. Obviously your body's going through a lot of changes, And so our goal is then to just alleviate those aches and pains to give you a much more pain-free and enjoyable pregnancy. So you can just keep active, keep fit, and then also, as Kayla mentioned, get back into exercise a lot quicker after having baby.
Okay.
As well.
So the actual exercises is different.
Yeah, so yes. So there are quite a few things that you need to avoid from your second trimester onwards. So your traditional crunches, your traditional abdominal work, jumping, high impact activity, all of those sort of things. And then there are a lot of things that you can focus on. You can work quite nicely into your glutes, into your lower body, get some nice cardio, get the heart rate up. There's so much you can do, and it's so nice for moms to feel that they can do those exercises safely and they can just relax in the classes knowing that everything they're going to do is going to be beneficial for themselves and for their unborn babies.
All right. So, for instance, if a mom is a bit worried about a diastasis recti, what can you recommend for such a mom?
So it depends on how bad the diastasis recti is. If they are in a lot of pain and they can fit quite a few fingers between that gap. So what we recommend is that you find your belly button, go just above your belly button and place your fingers
after
above or during a pregnancy.
Okay.
You could see the gap more than anything. During pregnancy it would cone, so you would get this coning shape when you're sitting up from a chair, maybe getting in and out of bed, you would see this coning shape.
Yeah, that is for, if you don't know that, it's when the muscles move, they separate.
Yes. Yes. So the muscles separate apart, those abdominal muscles in the front, and basically what happens is that you would get this coning formation if you are pregnant. However, if it's postnatal, you would be able to do your finger test. But if during pregnancy you've got that diastasis recti, we would highly recommend that if it is quite severe, that you go and first get a consultation with a health professional just to make sure that everything's fine. In terms of exercise, avoid any twisting movements, any traditional abdominal work, so any crunches or sitting straight up, doing your sit-ups. So really turning onto your side, getting out of bed, making sure you're not worsening it, and not too much bouncing or twisting movements, really just to activate those deep core muscles and really get some guidance on it, because if you do that traditional abdominal work, it can really lead to worsening it. So no planks or anything like that. And then getting that health professional's opinion on it. And sometimes the belly binder can also help just add some extra support if it is quite bad. But yeah, we would really highly recommend that you consult a healthcare professional if they do have that diastasis recti.
So in our classes we always educate our moms on what to look out for, so the coning, and then how to activate those deep core muscles so that they don't cone during the exercises. So in our classes we can see the mom's coning, then we'll modify the exercise to correct it, and give her some guidance on what she can do in her everyday life as well to avoid it. So I mean, it is a very common thing, and most pregnant moms are going to experience it to a certain degree. So it's often not something to be too worried about, but you just don't want to worsen it, and you don't want to be doing the wrong activities which will make your recovery postpartum that much more challenging. Yeah. So we want to just manage it throughout pregnancy as much as possible, so that afterwards we can get those abdominal muscles firing again and reactivating nicely.
So what classes do you guys offer?
Okay, so we offer prenatal classes, so those are our preggy classes that you can do during pregnancy, and those we offer in studio and online as well.
So prenatal fitness.
Prenatal fitness classes, yeah. So those are exercise-based classes, 45 minutes long, and we do a combination of your cardio, your strength and conditioning, your core work, your relaxation, your mobility work. So just a whole combination of all the exercises you need to do during pregnancy, and we tailor that according to your fitness level, according to any injuries that you might have. We can modify, if you're suffering from lower back pain, sciatica, we can modify the exercises accordingly. So we keep our classes quite small so that we can keep an eye on each mom, and we know what each mom is going through at that stage. So we like to know when your next scan is, we like to know whether you're having a girl or a boy, and just to keep it quite personal. And we get to know our moms quite well over that sort of period of time. So those are our preggy classes, and all our in-studio classes are just streamed online. So you just join as if you're in another member in the class. Then our postnatal classes, those are our mom and baby classes. So you bring baby along with you to classes. So that you can start 6 weeks post-baby if you've had a C-section, or 4 weeks post if you've had a natural birth. We just make sure you've got clearance from the gynae for all our classes to come and exercise. And there you bring baby along with you, and we work on re-strengthening the core, getting your fitness back, just strengthening all those muscles that were weakened by pregnancy and childbirth. And then just bonding and having fun with your baby and meeting other moms. So it's such an exciting time. So often those moms you've been doing preggy classes with, you'll see then in your mom and baby classes. So it's quite nice to just build that little community of moms helping each other out, you know, knowing what you're going through is something that they're all going through as well, and it's normal, and ask questions and that sort of thing. Then we also offer our baby massage course. So that's not exercise based, that's moms massaging babies. So we teach you different massage techniques over a 4-week course. And it's a really lovely, so many benefits for baby with the baby massage. Lovely for bonding, muscular development for the baby, relaxing and calming, so good for colic. There's just so many benefits to baby massage, and it's just a wonderful thing to do. And then we do our boot camp challenges. So that's sort of 3-4 months post having a baby if you want to just intensify your exercise. So that's our all online sort of based at the moment. So boot camp challenges that we run online as well. And then we've had various other challenges. So we've had a Restore Your Core challenge. We just sort of keep building on it. But our main thing is the pre and postnatal exercise classes.
And anyone can tune in because it's online.
Yeah.
Awesome. And you also do one-on-one. So it's not just group classes, it's one-on-one and so forth. Just whatever you do, make sure that you get some guidance for your fitness during pregnancy, for instance. How do people contact you?
So they can contact us via our website, so that's www.fitfor2.co.za, or they can follow us on Instagram, so that's Fit42SA, and Facebook, or they can phone us on our cell phones. All our details are on our website as well. Another thing we can also offer is just an online consultation. So if there's anything you're worried about, if you're worried you're not going to cope in the classes, or you've got some specific condition you're worried about, we also offer online consultations, and we can just take you through our process and see how best we can help and accommodate you.
Awesome. And we're also doing a fun giveaway for a lucky viewer. Ons maak 'n deel van die Om Swanger te Wees kompetisie waar jy 'n oefenprogram kan wen vir 'n maand deur Joel en Kayla. You want to tell us a bit more?
So we will be giving a voucher away, 2 vouchers actually, one for a month free classes of prenatal classes and a 1 month free of postnatal classes, so just depending on where you are. And we'll also add in a free individual assessment to our winners.
Lovely, so stand a chance to win this lovely prize. In the meantime, please also go and follow them on social media. What's your social media handles?
So the @Fit42SA on Instagram and on Facebook, both of them.
We will be seeing these ladies giving us some tips throughout the season for your fitness as well, just to follow along. And we are very excited about that.
Thank you. We're also so excited.
Wat beteken dit om swanger te wees? Ek is nou al in my 3de trimester van swangerskap en ek moes al heel wat aanpas by hierdie swangerskap leefstyl. So ek gaan 'n paar vrae antwoord wat julle my gevra het op social media oor wat dit vir my beteken om swanger te wees. En ek gaan hierdie vrae ook op my Insta story sit vir julle, dan kan julle dieselfde vragies ook antwoord in julle Insta story, tag my en jy kan dan 'n lekker prys wen, soos 'n oefeningsprogram verskaf deur Fit42. Ek gaan die vragies ook op my story sit vir julle, so onthou dit is @anayofficial._ op Instagram. Okay. So julle het my gevra, wat is my gunsteling trimester sover? Ek moet sê, in die eerste trimester beleef mens gewoonlik die morning sickness en die eerste verskille, jy begin die verskille raak sien in jou lyf. Vir my was die eerste trimester nie my gunsteling nie, want ek was die hele tyd net pe en siek. Ek is nou my 3de trimester, mens voel ongemaklik. So my gunsteling trimester is die tweede een. Hulle sê dit is die golden trimester en my ervaring is, dit is vir my by ver my gunsteling een. Een van die vragies wat julle my gevra het, is hoe het ek my man vertel ek is swanger en ek het eintlik ietsie baie spesiaal vir hom gedoen en ek het dit afgeneem. Ek het gemaak of ek 'n TikTok gaan opneem en ek het 'n boksie voorberei vir hom wat hy dan moet oopmaak en vir ons almal sê wat is in die boks en so aan. So ek het dit eintlik afgeneem met my foon en ek wil dit graag vir julle wys. Okay, this is what I prepared for my husband, Maurice. Roses are red, violets are blue. I have a secret, and here's the clue. Roses are red, violets are blue. Inside of me, 2 hearts beat for you. And then, when he opens it, little shoes. He takes them out. He sees a note. Only the best husbands get promoted to daddy. Put this inside. Positive test. Okay, I'm gonna tell him that I'm filming a TikTok and I need him to open the box. Baby, sal jy asseblief die TikTok saam met my gou doen?
Ja, ek wil nie nou.
Asseblief. Nee, sit 'n TikTok. Gaan naar die kachel toe. Dis vir die TikTok.
Wat is dit?
Maak het oor. Bring het hier. Okay.
Okay, this is a red, but it's a blue. I have a secret, and here's the clue. Roses are red, violets are blue. Inside of me, 2 hearts beat for you. Jy joke. Is jy ernstig? Jy joke. Oh my son. So awesome.
Onthou, jy kan ook met ons jou antwoorde deel van die om swanger te wees kompetisie op Instagram. Sit vir ons jou antwoorde op jou Insta story, tag my en volg die instruksies en jy kan dan 'n kans staan om 'n lekker prys te wen. Soos 'n oefenprogram verskaf deur Fit for 2. Ek gaan die antwoorde ook op my Insta story sit vir jou. Onthou, dit is @anayofficial._ op Instagram. Baie dankie dat julle saam met ons gekuier het vandag hierso op Ons Groei Saam. Volg ons op ons sosiale platforms. Ons is beskikbaar op Instagram as Ons Groei Saam. Ek is ook beskikbaar as anayofficial._ en onthou om deel te neem aan ons kompetisies waar jy groot pryse kan wen. Onthou om ook met ons jou antwoorde te deel van die om swanger te wees kompetisie. Sit die antwoorde op jou Insta story, tag my en jy kan dan 'n kans staan om 'n lekker prys te wen, soos 'n oefeningsprogram verskaf deur Fit for 2. Ek gaan die vragies ook op my Insta story sit vir jou. Onthou, dit is @anayofficial._ Baie dankie dat julle saam met ons gekuier het vandag. Ek sien julle volgende keer op Ons Groei Saam.